period where the world is experiencing a pandemic, I am not necessarily worried because I know my body is capable of fighting against this virus. But I come from the parts of South Africa where people's immune systems have been largely compromised, where the right to health service is more of a privilege than a right. The parts where 10 people can sleep in one room on a floor that is not hygienically clean, and so things like TB and flu are almost inevitable. How much more this virus? In this time I realized how privileged I am just for being healthy, but I worry about my people back home. If one person gets it, the entire community has it. And the hospitals close by are not even prepared to take care of them because they themselves have a hygiene problem. So one person waiting in a queue for hours to check their fever and cough would have already spread it to those around them before they even get to the reception. The other thing is people are so poor that they don't have time to think about their health. Children need to eat. I see mothers with children in the streets asking for money instead of self-isolating. Street vendors still working, and they have a lot of physical contact with people, but they can't stop working because their families depend on them. So the right to life, to food, and maybe to shelter is being compromised. And all this because our health systems, which have not been developed in the townships, and all this because our health systems have not been developed in the townships. The economic interventions that our government has proposed have largely, I think, been directed towards the most privileged in our society. The lowering of interest rates is not going to directly resolve the economic and social conundrum that the poorest of the poor have. By this, I'm talking about a choice that many street vendors, many of those who live from hand to mouth, many of those who live on wages have to make, which is effectively to starve or to protect yourself from the coronavirus. The verdict on them is if I stay at home and self-quarantine, I will not have money to provide food for my children and for my family. So either way, the poorest of the poor must suffer. Another one of our leaders, also a young woman, phrased her experience like this. She said, economically, the single mother of 5 who works at ShopRite can't self-isolate. Only a few who are financially well can. Those who brought it to South Africa in the first place, because they have the money to do so. They have emptied the sanitizer sections, immune boosters in stores. Like that wasn't enough, they have also finished groceries. The entire system of prevention that is being implemented is not helping my black people. Some get paid weekly, so they can't buy in bulk. Some depend on daily jobs, so they can't self-isolate. The government hasn't been giving steps that will help the majority of South Africa. Public transport is you're urged not to use public transport, but taxis are still operating. Our political parties, who always make promises to help the marginalized, should find a situation for people to still eat and have money to survive in self-isolation. However you look at it and however you try to debate this and however the politicians, the intellectuals, the academics try to spin this, the system is so broken, and in a time of crisis, the brokenness and the cracks are revealed. When we come to the understanding that the next 3 weeks is going to see the number of cases explode, and with that explosion in numbers, the measures that the government will put in place will be more extreme. We as leaders in our communities are trying to figure out ways of how to mitigate this. But the reality is that we have effectively been left behind by the government. The ad hoc measures, the bandages are not enough to, in a time like this, fix a system that disproportionately works against the poor and the black masses. That's the reality. And when we speak to people in our communities about what is their lived experience, 25 years into a dispensation, that claims to be founded on the advancement of human rights. Many of them, and it's important for us to not put words in their mouths, but when you speak to them and ask them what has 25 years of freedom, and many of them will say very little in terms of advancing my human rights. And these are just a few of the conversations that we've been having, and I've tried to make this video as casual as possible so that we can interact, we can engage. It doesn't have to be formal. You don't need to be a professor, an academic, or anything along those lines, but to feel free for your experience. And these are just some of the things they've highlighted. But one of the things that I must say, and I know we don't have enough time to say everything, is many of the women in our network, many of these amazing women who are really the bedrock of Ubuma, have talked about what does the quarantine mean for people who live in abusive homes. How do I self-isolate or quarantine, find myself staying in a house where I'm living with an abusive man? For many in our country, work and school is a solace. The ability to go to work, the ability to send a child to school means that you go to a place where you are protected from some of the violence that takes place in the home. And at the Black Men's Imbizo, we are trying to find ways, to deal with it. And it's something that we are in for the long haul. But presently, right now, with the situation, it is important to note that many in our countries have effectively been quarantined to zones of abuse.